Healthcare providers say that the United States is facing a crisis in maternal and prenatal care. Advocates say the need has only grown since the Supreme Court's decision to overturn Roe v. Wade. Reporter Natalie Brandt has the latest details.
Camry Gibson is adjusting to life as a new mom. Her son Zaire is just a few weeks old.
Trying to get him to differentiate between his night and days.
Gibson lives in rural Mississippi, where she had to drive about an hour and a half to receive prenatal care.
When I went into labor, they were in a state of panic because it took me so long to get there.
It's estimated around 7 million women in the U.S. live in maternity care deserts, where no hospital or provider offers obstetric services or maternity care is limited, according to the March of Dimes.
And what does that turn into? Skyrocketing rates in the United States for infant and maternal mortality. 60% of those deaths are absolutely preventable.
Assistant Speaker Katherine Clark of Massachusetts has introduced bipartisan legislation called the Babies Act, which would expand access to birth centers and midwives for Medicaid recipients. Getty Israel founded the nonprofit Sisters in Birth in Jackson, Mississippi, to try and address the grave need in her state.
Birth disparities here are the highest in the nation.
Israel is now trying to raise funds to also build a freestanding birth center where nurse midwives can deliver babies.
We've had women die trying to get to a hospital because hospitals are not in the zip codes where they live. We've had women to have babies in their cars. Women have babies at home because they could not get to a hospital.
There's just so much that can go wrong.
Gibson knows pregnancy and childbirth can be stressful enough. She says finding care shouldn't be. Natalie Brandt, CBS News, Washington.
A pilot program run through the Center for Medicare and Medicaid Services found Birth Center had birth outcomes better than as well as cost savings. There may be soon a new tool in the fight against COVID-19 for kids. Pfizer and BioNTech have announced that they've finished their submission to the Food and Drug Administration for an emergency use authorization. The request is for an updated booster shot for 5 to 11-year-olds. Officials say this shot focuses on strains that were part of the original vaccine and new variants. The 10-milligram dose of Pfizer's bivalent vaccine is already authorized for people 12 and older. Moderna also filed for authorization of its booster for children as young as 6. Want to know how the U.S. economy is doing? Well, up next on Valley News Live at 5, what to look for in the coming weeks.